Okay, we focused on lifestyle a lot here and behavior modification, but now the question fourth from the bottom, is she a good candidate for weight loss med or other diabetes medications? And that really is an important question. When do you have lifestyle up to a certain point and then consider a medication, or should a medication be considered earlier for a patient like this living with obesity and type 2 diabetes? Bob, let's start with you on that one.
Yeah, so there's a very important observation you just made, or observation or recommendation I'm going to give. I think a lot of primary care providers think a patient has to fail lifestyle treatment before you accelerate and become more aggressive, and that's absolutely not true. What you're looking for is a patient who is engaged in self-care, maybe tracking your diet, aware of what they're eating, being more physically active, making appointments with you for touch points. And if that is insufficient, then I would become more aggressive earlier rather than later. I think this is an excellent patient, but once you've done the groundwork of foundational changes, to think about pharmacotherapy. And we now have pharmacotherapy that will treat both diabetes and obesity using a GLP-1 receptor agonist, and hopefully soon a dual agonist, GLP-1, GIP in the near future for obesity as well. These medications that work pharmacologically through different integrated systems in the brain change behavior. They change appetite, hunger, fullness, thoughts of food, cravings. We have all seen patients that have had difficulty following a diet, and you put them on a medication and they become more adherent, because they don't have the noise going on in their head about I'm hungry, I'm not full, and I'm thinking about food. And if you could quiet the noise and give them a sense of control, they could be very, very successful. So Bob, the bottom line is I would absolutely be thinking about a medication for this patient earlier rather than later in the course.
Holly?
Totally agree. And I love that comment. One of the things I always say is, think about your hypertensive patient. Do you make them fail a low sodium diet or some type of diet before you would consider adding a medication? And I think for most people that's no. So same thing, I would be thinking of this simultaneously. I think that this makes sense in her. And so depending on her feelings about it, obviously, I would definitely be thinking about that. And I also love the comments. And this is one thing I talk to my patients about sometimes when I'm talking about medication, is the kind of the two-way street between physiology and behaviors. You know, they tend to separate them and think, well, my metabolism or my physiology is this way. And I talk about medications definitely work on that physiology, but I also talk about how physiology is hooked to, impacts behaviors, and how behaviors can impact physiology, and that they're really not as separate as we sometimes like to think of them, that they're intertwined. And so, yes, we're going to work on the behavior side, and that can impact your physiology. We can do medications that work on physiology that's going to impact your behaviors. So they really work together. It's not like you have to choose one or the other. You can use them successfully together. And yes, it is about your metabolism and physiology. Let's optimize that. And let's use behaviors to allow the medications to work the best they can. Let's do both things to have them work together.